Hi, in this video we'd like to talk about in vitro fertilization and why sometimes it's unnecessary or why you are not seeing success with it. So IVF is also known as test tube baby because you can literally make a baby in the lab using IVF, and it is currently the most popular assistive reproductive technology in the world. Many patients who are experiencing miscarriage, infertility are immediately recommended IVF because it's very popular, and also they guarantee you success, or you can hear stories from your friends and family of how it can help you receive your own baby even after several failures of your own. However, if you do take a look at the details, you'll notice that IVF success rates are consistently 30 to 35%. Now, there is a reason for this. So IVF, what they do is that they acquire the sperm cell and the egg cell from the couple, and then they will make it fuse, a process known as fertilization in the lab. And then after 6 days or 7 days of culturing in the lab, then they will make it implant, put it back into the endometrium inside the uterus of the mother, and then this way you will get pregnant and then sustain the pregnancy for full term. However, many patients don't see success, or they see failure during week 6 or week 7 of pregnancy, because usually they do not have their underlying cause treated. So for patients who have infertility, usually there is an underlying cause, but they rather just straight go into IVF instead of receiving treatment, which is why we consider this as a detour, because not only you are wasting time, you are wasting money as well. You would much rather see higher success if you go for treatment instead. And for recurrent miscarriage patients as well, they believe that IVF can give them the family that they want. They can allow them to have babies that they want. However, they also see repeated failures, so they put so much of their savings, money, time, years and years, and then also the incredible amount of stress that is the mother is experiencing due to IVF because of the medication that she needs to take, and also the process of acquiring the egg cells. These are all not easy to endure. But if they still see failure, then it's clearly a waste of time. So that's why here at Antai Hospital, we always recommend that IVF is not a cure for all. It will not give you a success, a guaranteed success. In fact, its success rate is extremely low. IVF is only specific to the indication of fallopian tube disorders. Specifically, if you have no longer any fallopian tubes, then you can go for IVF. If you have fallopian tube blockage, then you can also consider IVF. However, if you have recurrent miscarriage or other forms of infertility that are unrelated to the fallopian tube, IVF will not be successful regardless of which IVF expert who has thousands and thousands upon of successful cases. If it's not specific to the indication, you won't see any success. But these doctors won't tell you, because IVF is a very lucrative industry. It's a very profitable business. So they rather see you fail and make money than tell you and then lose you as a customer. So here at Antai Hospital, we always try to educate our patients who are desperately seeking to start a family that you need to seek treatment. It would make much more sense that if you have a defect with the uterus, IVF will not help. Rather, you should go seek treatment to fix the uterus. Then you won't need IVF anymore. You can save a lot of time, you can save a lot of money, go for healthy pregnancy. So here at Antai Hospital, we've already tabulated that both infertility and recurrent miscarriage has its own individual causes. Infertility has up to 150 individual causes, and recurrent miscarriage has up to 43 individual causes, all of which can be overcome without IVF. And the benefits is that you can save a lot of time, you can enjoy a natural pregnancy and give birth naturally as well. So as a conclusion, we'd like to educate our patients that your recurrent miscarriage, your infertility, if it's not the specific indication, which is fallopian tube disorders, then IVF will only be wasting your resources, your valuable time. And then it also has decreasing success rates if you are past over the age of 30, 35, because your sperm cell and also egg cell quality drops significantly. So seek treatment rather than assistive reproductive technology, because treatment serves to give you the highest chance. And here at Antai Hospital, we offer you a full refund guarantee. If we do not get you pregnant, if we do not secure you a full-term healthy pregnancy and healthy babies, then we offer you a full refund. This is not a detour, this is actually the correct route for you to avoid wasting time, wasting money, and doing it the right way. Get in touch with us via the website, also leave me the comment down below.